You're live. We are live.
We are live. 2 nights in a row.
Everybody.
Welcome on this wonderful Sunday night. My name is Mel, you know Charlie, and we got a special guest tonight, Morgan Lopez from the HLTA.
Hi.
She's going to be covering their big crusade or their promotion on trying to get some masks. We're going to leave that up. She's going to talk to us in a little bit about that. But before we start, first I want to thank everybody for joining us tonight. As every night, you know, we said we're going to be doing this every single night until this virus pandemic is over. And we're going to continue to share the word, and hopefully at some point everyone will be on the same page. So we try to bring on interesting guests every single night, because I know you guys are sick and tired of me and Charlie listening to us every single night. But before we start, I just wanted to say to Charlie lost his brother yesterday to the COVID-19 virus. I want to send our condolences and prayers, Charles. Very sorry. I know we all been following you through this last week with the updates, and it was a roller coaster ride for all of us. Unfortunately, your brother passed away yesterday. Prayers, condolences out to you and your family, Charlie. It hits.
Thank you, brother.
Now it's personal. You know, Charlie's been on this crusade for a while, trying to get the word out, but now it's there. A brother, a family member. And Charlie, I don't know if you want to take a few minutes to share with everybody that has been part of this journey.
Sure. Well, thank you, Mel, and welcome, Morgan.
Thank you.
To those of you out there, I cannot express my deepest thanks to all of you for sending in your prayers. Today, when I broke the news this morning at about 6 a.m. Hawaii time, my brother passed away 8 p.m. last night while we were on air, Mel. And so this morning I had a ton load of messages, it's the most I've had. It's close to 538 messages on the back end expressing their condolences. So, you know, for those of you out there that I've been pounding the message in and day out, stay home, okay? Practice social distancing. I'll tell you the reason why it takes another turn to the equation that you folks don't know about. We lucky we live Hawaii. My brother's in New York. Do you know that I cannot get arrangements made for him because they are so backed up until sometime in the summer? So we're talking about June. Can you just imagine your loved one sitting up there in the hospital morgue? You cannot do anything right now because all the funeral homes are backed up. That's something you don't think about, but that's a reality. And if we're not careful, and you've said this many times, Mel, if for some reason a number starts spiking and we start getting the deaths, and I pray to God we don't, but if we do, you worry about not enough hospital beds. I don't think you'll have enough mortuary space to conduct services for your loved one. That's what I'm afraid of. So I just like to say, you know, keep in mind, folks, there are a lot of things that can happen. And how do you avoid that? By just staying at home. Let us flatten the curve. And, you know, Morgan, we have some very important questions for you today because it deals with tourism too. But I just want to get the message out there. Let's flatten the curve. We're doing a good job, Kauai. I know some have said, you know, you pounding this into us. We're doing everything possible, and you're right. But we have to continue because it's not only Kauai now. Our last holdout, Lanai and Molokai. Molokai got struck twice, back to back. And that's a small population base, but it can run away from them really fast. So with that said, Mel, take it away, Mel.
Well, Charlie, I know, like I said, a lot of us been following the journey, and you know, a lot of people are paying attention. A lot of people are listening, but a lot aren't. And before we get bombarded with questions and comments for Morgan, about the visitor industry. She's with the Hawaii Lodging and Tourism Association, not the Visitor Bureau or the Visitor Tourism Association. She's going to be talking about a couple of programs that the HLTA is doing for our first responders and our people that are out there working hard to protect the people. But again, I am getting frustrated. You know, I posted a post today about we're ready for a total lockdown. You know, our mayor, our mayor last week said that, you know, he wasn't afraid to clip it. If people abuse these, the luxuries that we have, the fact that we can go to the beach and we can go surfing and swimming, we can go to the we can do things. But he was very upset that people were abusing that. And we know they're abusing that. We see the abuse. We see the amount of cars on the road. We see the amount of people lounging on the beach. Now, Charlie, I'm sure I can speak for Charlie. We get a lot of messages, I know I do, from the public. It funnels through us. And pictures of beaches, beach full of people, not just tourists now, local people with umbrellas and coolers. Kekaha, just today, Kekaha, Kalihiwai, Lumahai. And so I post up, you know, maybe now it's the time for lockdown, and guys get irritated and upset. But bottom line is, what is it gonna take, people? We heard Charlie's story. We heard Charlie's story today. 4 people already in the state of Hawaii are dead. At what point do we say, oh, now we better get serious? That's the frustration. At what point do we say, okay, now let's get serious because we hit that number of 5 or 10. I don't know what the number is. The number should be 0. We should be proactive and stop it before it gets to that point. So we'll be talking about that more later on. I really wanted to get that off my chest because I've been reading some of the comments. Most people, I got to tell you, the vast majority of people support a total lockdown. Total lockdown. Hey, food, medical, and work. That's it. Other than that, you stay home. And it's not martial law. It'll just take a whole bunch of cars and people keep them at home where it belongs. This virus is dangerous, and we all know that it's contagious. And tomorrow night, we're going to have Charlie's brother's soulmate on. She's going to tell you guys what it feels like to have a loved one go through this and die. She's going to be on tomorrow night at 7 o'clock. And on Tuesday night, we'll have Lieutenant Governor Josh Green to give us the real scoops about what's going on in the state. So we're trying to put together a package for all of you that's interesting and factual. But I think tomorrow night, you'll hear it straight from a loved one that lost a soulmate. And maybe that will wake you guys up. Maybe that will wake, and I'm not talking to all of you. Those of you that are practicing the social distancing and staying at home, thank you. But it's those other COVIDiots, as the mayor calls it, I love that, the COVIDiots out there that's going to cause a problem. So anyway, thank you for listening to my rant. Morgan, why don't you start off by introducing yourself and saying a little bit about yourself, and then tell us what we can expect or how we can help the HLTA.
Okay. Aloha. My name is Morgan. I'm the Executive Director for Hawaii Lodging and Tourism Association for the Kauai chapter. We have several initiatives that we're working on right now. First and foremost, we're working with many of our nonprofits. As you know, our charity walk has been postponed to November 21st, save the date. We're still going to put that on because we know that if anything, more than ever, our nonprofits are going to need it this year. So we have many that are interested in assisting with it and putting the event on. Our page continues to receive numerous donations to the charity walk event, even throughout all of this, which is amazing. But one of the things that we're helping our nonprofits with is getting them what they need to help our community. We have Kauai Independent Food Bank and Hawaii Food Bank. Kudos to you because they're really assisting many of our nonprofits with getting food out there. Salvation Army, we're trying to find some supplies for them. They have a soup kitchen that they provide 4 days a week that goes to houseless, seniors, fixed income, low income families. They also delivered some food to our seniors. They have some church that's baking fresh bread for our seniors. But they are in need of to-go boxes, the 3-compartment to-go boxes. So any restaurants out there that are shut down right now, if you can spare those, please let us know. We can certainly use that for food distribution. Let's see, we have a lot of our nonprofits are in need of PPE, which is personal protective equipment, gloves, masks. We're working on masks. It's a whole nother thing we'll talk about, but they also need cleaning supplies, bleach, Lysol, hand sanitizer. So please stop running to the store and buying it all up, because our nonprofits are also in need of it. If you're staying home, you don't need these supplies to be constantly going out. We could also use gas cards, because a lot more of the nonprofits are doing deliveries, which wasn't included in their budget, and just don't have the funding for it. So if you want to contribute that way, that's a great help for them. Boys and Girls Club has a great online program on Instagram. They do that weekly, and that's open to any children who are interested in doing it. It's every day, Monday through Friday, 10 a.m. It's about an hour and a half long. Instagram only allows 1 hour. So they take about a 5-minute break, and then they come back on for another half hour. And so for that program, they have it set up daily where they're doing art classes. They're teaching them how to cook. They have STEM. They do a dance class on Wednesdays, trivia interaction. So that's something fun for the kids to do. But also at home, besides their schoolwork, we're looking for things to just keep them active. So if you have any children's books, if you have games that aren't missing pieces now, they could use that. They could use art supplies as well. And those can be dropped off to either the Lihui or the Kapa'a location. And you want to give them a call first before you head over there. But yeah, so there's just so many nonprofits right now that are really reaching out to those in need that aren't able to get to the store and purchase what they need to get through this. So that's a huge thing, and that we're trying to get together for them. So yeah, that's one of our things that's going on. But
well, thank you very much. Now, before we get into it, who can they call, or is there a website? Is there a Facebook page that people can?
They can go to our Facebook or Instagram, and that's HLTA Kauai. They can text me 651-5480. That's my work number. So
okay, I was just too late. I already came out. So okay, that's your work. 651 what for?
5480.
5480. Hope you guys writing this stuff down. It's your work cell, guys. Okay, it's your work
yeah.
phone.
And then we also have my email, which is morgan@hltakauai.org. And all of that can be found on our website, which is HLTAKauai.org.
Alrighty. Thank you for that. There's a lot of people that want to help. There's a lot of people. I mean, we got a whole bunch of people sewing now. That's
yes.
Masks. I cannot believe from morning till night she's sewing masks. No more baking. No more peanut butter cookies. No more chocolate chip cookies. It is sewing now, and she's doing masks. Charlie, you started to sew a mask.
Yes.
Today.
Well, I first want to applaud everybody that's throwing their hat in the ring sewing. I started because, with isolation, you got to find something to do. So right now I am sewing, and I'm making a reusable toilet paper right now, since we have a shortage of toilet paper. Yeah. So.
Good job, Charlie. Good job, Charlie.
Hotels for Heroes.
Hotels for Heroes is a new initiative that HLTA has come up with. They've worked with HTA, Chris Tatum, and Sue Kanoho at HBCB.
Morgan, Sue Kanoho is on and watching, so.
Hi, Sue. So we have come together in a partnership, and we are offering complimentary hotel rooms for individuals on the front lines that need a place to stay, to rest their head. to get a break from their long day at the hospitals, any first responders. Then we have people that want to have somewhere closer to the hospital where they're working instead of driving their far distance. And so HLTA was able to get the participating hotels set up. HVCB is working with the hotels to set up reservations for those in need. And HTA is arranging funding from all of our state tourism dollars that will pay for this. So if any employees are in these fields, I've already reached out to Hawaii Enforcement, Attorney General's Office, DNLR, DPS, DOT, EMT, and all of our paramedics for all of the major islands. So we are participating with each of those. And this is pretty much just our way to say how much we appreciate all that they're doing for our islands.
I know, sorry, but first of all, Sue said hi. I don't know if you're seeing the comments, but she said hi.
Oh, yeah. Thank you.
That whole segment that you just said,
Uh-huh.
it came out all messed up because of the connection. So can you repeat what you just said?
Everything.
Why you guys are doing it, and
Okay.
I think I made
So
part of it about allowing the family or the first responders to have a place to stay. And
we're basically providing a program that offers complimentary hotel rooms for individuals on the front lines. Anything between medical and first responders. There's many agencies that which HLTA reached out to participate in. And it's just our way of giving back to those that are assisting our community.
thank you. And I know I just got scolded for touching my face, but it's itchy. So I
go wash your hands then.
My good friend Judy Vegas scolded me. I know Charlie replied to the text, but someone asked about the number. It's 651-5480, and this is Morgan.
Yes.
You can also get her at morgan@hltakauai.org.
Hey, Mel.
Yeah.
Mel, I just noticed one of our rent-a-cars here on Kauai. They're offering free rent-a-cars to first responders to help out.
Correct.
That's pretty. Yeah, Hertz. That's pretty cool.
Hertz Rent-A-Car is offering first responders free rental cars, and this is, for those that families that have one car, or they may have two cars, but one car is the family car. This will give them an opportunity to rent a car, or not rent, get a car for free, so they don't have to inconvenience the family. Or they, it's sad. These guys are in the battle. They're in contact with a lot of people, and some don't want to take a chance and share it with their family. So this hotel program is a great program, and thank you, Hertz, as well, for allowing that. Royden says rental-car companies should not be renting cars. If you're in quarantine, you don't need a car. I tend to agree with that, but this is for the first responders, free cars for the first responders. Thank you very much for that. Morgan, do you have any idea how many hotels are open right now on Kauai?
I don't have a number for you. It's minimal. There is not as many tourists as everyone keeps grumbling about. I have to say that after talking to the few hotels that are open and assisting with our Hotels for Heroes, it wasn't as many as I expected.
Yeah, I think obviously more are going out than are coming in, and we still have some coming in, trickling in, and it's still an issue, but it's not the issue that we had. Sorry, I'm reading comments. It's not as many as we had, and it's dwindling. That's why I keep saying pretty soon you cannot blame the tourists. The pictures that I saw today, in fact, was more locals than tourists on the beach. So if the airplanes all stop today, we're still going to have a problem because of the locals that are abusing the rules, and that's the problem. So what about us delivery guys? UPS is delivering 1,500 packages a day. Be safe, man. Gloves, mask up, do what you can. Everybody got to take individual responsibility and be as safe as you can. And, we just pray for everybody's safety.
Yeah, I think that's a huge thing right now is there's so many employees out there that are not wearing face masks. So I think that if a lot of them would start utilizing it, it would share and set the example for others out there to do the same.
How many, again, how many masks do you think we need, or what is your goal on Kauai?
Oh, we have well over 3,000 requests for face masks on our list right now. And that doesn't include everyone that's on our list. We have people listed, but we don't have numbers of employees that actually are needing these face masks. So we have over 80 different organizations, I think, on our list right now. And this is for Massive Mask for Kauai, HLTA, myself, along with many volunteers. It's a volunteer program. We started a Facebook page. Chris Hunt, thank you so much. She got that going March 25th. And we have over 500 followers on that page right now. Lynn Miley Taylor was the one that had suggested it because Wilcox was in need of face masks. And so everyone kind of just jumped in. And every day I receive another volunteer or two that are willing to assist with sewing and getting these face masks created for everybody in need on island.
Well, you have over 200 viewers right now live. And by tomorrow morning, we'll probably have about 2,000 views. So expect that phone to ring. I think a lot of people want to help. They just don't know where to go. So if you're interested in helping with the mask project, please let Morgan know. And maybe we can get Charlie some material so he can stop trying to sew some toilet paper. That's not good, man. That's not good, Charles.
And for
I'm bored.
massive...
I'm bored. I'm bored.
Charlie, I have tons of fabric for you to cut.
Oh, good. Okay.
Yeah.
That's a start.
Everyone's wondering how they can help with getting these face masks created. I don't know how to sew. I can't do that. I don't have a sewing machine. Well, we have ways. We have our charity walk t-shirts that we're actually cutting up. We cut off the bottom strip and we turn it into a 1-inch strip. We stretch it out, and that's what we've been using instead of elastic, so we can tie our face mask on.
Good idea. Good idea.
Ends up being like this. And so that's going to be going out. We have 1,000 requests for face masks from Kima right now. And so we are working on that project on top of everything else that we're doing. So highly recommend face masks for everyone. If you need one, if not, just stay home. You don't need a face mask. You don't have to contact me if you're not going anywhere.
And again, the mask is not a free pass to go out. That,
exactly.
Remember one thing, and this stuck in my head, and I keep hearing on the news it being to remind people that the mask protects others from you, but it doesn't protect you as much from others with the virus. So that mask is in some cases, I think it gives people a false sense of security that, oh, okay, I wear my mask, I can go out. That's not true. That's just not true. And people got to understand that is to protect, in the event you're carrying the virus, from spreading it to someone else. But that virus comes into you and it stays on that mask, it sits there and you can get it. So guys, just got to be careful, be smart. There's a lot of questions, but we'll get to the questions later. Any hotel questions or HLTA, we really want to focus on the mask project. We want to get those masks out. So our first responders and those that the essential workers can get some sort of protection.
Yeah.
Hey, Morgan.
So
Morgan, question. When the masks are done and delivery, who's doing the delivery? And I know it becomes kind of risky when you got to go out and deliver the mask to your clients, whoever is asking for it. Is it you folks are doing it, or you have a company that's actually assisting you folks?
So we're just made up of volunteers. So basically, when people want to donate fabric or any supplies that are going to our cause, we're asking that we pick it up. I have 2 drivers, one for the North Shore and one for the South Shore, that drives and picks up and delivers. And it's a very quick delivery. We are wearing our PPE as well. Most times people are going to leave it on a bench in their garage, somewhere that's easy just to pick up or drop off, so that way we're not having a lot of interaction. And then anybody who is donating, we are asking questions about their travel history, as well as any symptoms that they're having within the past month. That's for everybody who's volunteering, everybody who's donating. And then we are washing all of our fabric before we're putting it together. And we ask everybody to please wash their mask when they receive it as well.
Perfect. You know, I don't know if you got to see Mel, but they had a little spot for, I believe it was Iolani, that on Oahu, and their program where they have the 3D printers. They're making up all those face shields. I mean, kudos to them, boy. And they're bagging it. They're leaving it on a bench like a drive-through system. And they're when they do the pickup, they're guiding the people to grab it themselves. And every bag is marked who gets what. So I think that's an excellent program.
We actually have one. So the Canoe Club here on Kauai that's working on it. Luke Evslin is assisting with that project, and they're providing some face masks or face shields for our first responders. So
Good.
He is coordinating that. And then we do have Makerspace Kauai at Kauai Community College that's assisting with pieces of that as well. So.
Okay. And, you know, I do want to apologize to the viewers out there. Every once in a while, you see a big paw come across the screen, which is my hand. It's just that so many of you, the loving people of Kauai, have been sending, and elsewhere have been sending messages, and it's popping up on my screen, so I can't see what's going on. So I'm just trying to clear it. So I apologize. I'm not trying to reach for you through the screen. So don't pull back, okay? Don't pull back. It's just me. Thank you.
You
Okay,
scare
Mel.
every time your paw comes up to the camera, I notice on the numbers we lose a few people. I think. Anything else, Morgan, that you would like to add?
No, I think that's it. I just want to, I know there's people out there that are doing the push-up challenge and see a shot, take a shot. So many challenges out there. There's some people that are just being couch potatoes, sitting there watching everything on Netflix and eating everything in the fridge. But I would like to challenge everybody to reach out to me, take a few minutes either to make a donation towards our cause so we can purchase more fabric. If you have a pair of scissors, you can help. We have to cut out hundreds and thousands of these pieces that get put together into face masks. So I challenge you to reach out to me and donate at least an hour of your time to cut some fabric.
Okay, ladies and gentlemen, that's 651-5480. That's 651-5480, or Morgan at HLTAKauai.org. That's Morgan at HLTAKauai.org.
Awesome.
Go up to the challenge. Let's do it now. Just go up to the challenge. Let's do it now.
Want to say a special mahalo to Teresa and Randy Nero. Randy with the police department. Teresa is with the finance department. They've been pumping out a lot of masks as well.
Yes.
So there's a lot of you. Thank you so much. I mean, everybody do their fair share, but Morgan, thank you for joining us tonight.
Yeah,
And
thank you.
when you get when anything comes up and you want it out there, let us know. We'll bring you right back.
Oh, all righty.
Okay.
I'm gonna hold you to that.
Okay.
All right, you guys. Thank you so
very
much.
Take care.
All right.
Take care. Thank you.
Again, that was Morgan Lopez with HLTA Kauai, doing a fantastic job trying to get some emergency supplies out, cleaning supplies, disinfectants, and all of that to our first responders and people that need them. Again, pardon me because I'm looking at the comments. I'm trying to get down some questions that I know you guys have a few questions.
I think a lot that I've been seeing is pertaining to the quarantine. I saw a lot of questions pertaining to the quarantine.
Well, I think we all are questioning. This is a honor system quarantine. I mean, and I think that's part of the problem.
Yeah.
But again, the issue is we just have too many people out and about, too many people potentially violating the rules. Somebody talked about why is there lines at Costco every day? Understanding they have a limit of how many people can be in the store at a time. So obviously not everybody can be in there, but that line is around the store every single day. And how much food do we need? Are we shopping every day or are we going once a week? So that's one of the concerns that someone was mentioning. The other one is, are they planning the recovery? What are the recovery efforts going to be once we open up? And I would assume that most of the states and counties' resources right now are being really targeted to getting through this. People need to understand that this is still the beginning, because everyone else is so far up ahead of us. But you got to, they're time-wise, they're ahead of us. 2 weeks, some of them 3 weeks ahead of us, as far as when they were introduced to the virus. So we have a ways to go. We're talking not probably April 30th, May 1st when we get to the top of the curve, and then it flattens and then it starts to subside. So we're talking, we got some time left, people, and the numbers will climb, both cases and deaths. And I think we got to understand that. So I know a lot of people try to minimize and hope that it's not going to get that bad, but realize that it will, and we gotta do our best to stop that and get to the flattening of the curve sooner than later.
Well, you know, for those of you out there, and Mel, you know how I feel about this. We talk about flattening the curve. We're doing everything possible, but yet one thing that is a pet peeve, and again, I just don't know. I am not asking for sensitive information, government. I'm asking for a list of where those individuals that tested positive, just where they visited. I can do the rest. I can figure out if they were there the same time I was there. I mean, give me something. Because last night, just watching on the news in the beginning, like last month, it was saying you have to have come in direct contact. Now they're saying as long as you have close contact, you should be tested. So you see how the story shifts now. So it almost has the appearance that we'll address it as we go along. Well, you know, my brother's at peace now. I wish I could say that we'll go as we go along. My brother is gone. This virus took him. So I cannot buy that. We'll think about it as we go along, because people that have compromising conditions, medical conditions, may not have that time to spare. And that's what I'm worried about. That is what I'm very, very worried about.
I think we've been saying this for a while, and at what point, you know, do we wait for community spread? I can remember in the early couple of weeks ago when the state health director was talking about, and even the governor was talking about, you know, we'll consider those things when there's evidence of community spread. Why would you wait for community spread? We know that community spread is here. It happened on Oahu. It happened in Molokai and Maui. And yes, the numbers don't show a community spread case on Kauai yet, but you are a fool if you don't think it's going to happen. I mean, it's just going to happen. So why wait for that though? Why wait for community spread? So now the infected source is here. It's not a visitor that's going to leave. They're here to stay. And if we don't find out who they are early, and we don't take early, that's how it spreads. And we got to understand the testing. We heard from Senator Kochi a couple nights ago, and the test results are 4 days, much sooner than it was. You heard Senator Kahele got his results today. 16 days he waited for his test results. 16 days. Senator Kochi got his last week Wednesday. That's about what, 12 days or whatever it was. So, but now it's 2 to 4 days. So we're going to see much quicker results, and the numbers are going to jump. So we got to be prepared for that. But my point is, why are we waiting for it to be bad, really bad, before we escalate our defense against the virus?
Well, I'll share another boogeyman story. Imagine a person in your household tests positive. Okay, so now he needs to be isolated. Doesn't go to the hospital, but must stay at home. He gets a test result, he's positive. So now he's at home. You got 2 small little ones, you got a wife, and then the wife tests positive. But yet they don't want to test the children. And you got to wait for a result. All you're doing, in my simple way of thinking, is that we're taking this virus and all we're doing is we're incubating it in a home and it's just floating around. That's why sometimes I wish the test can come out faster so we can move faster, that if the kids themselves are not affected, get them out of that situation because their parents are infected. They don't need to be infected. Those are the kind of things that, you know, I would like to see done. But again, I guess we just got to stand in line, right? Before anything is done. I mean, that's what it seems like. So,
Well, hopefully, I cannot get out of my head your point on knowing where these cases are happening.
mhm.
To me, that's, and when it first came out, we watched that press conference, and Sarah Park, Dr. Park, and Anderson said that it was a HIPAA issue. It was a HIPAA issue. And it's so obvious that it wasn't a HIPAA issue. The issue was that they didn't want to release it to create fear in the communities. That's my assumption. And they couldn't say that on the live press conference, so they came up with HIPAA. And everyone bought into that, like, oh yeah, HIPAA. Well, you don't like violate HIPAA. Well, I told Charlie, I said, if that was true, if HIPAA was involved with letting people know without releasing names where a event occurred, like a COVID-19 infection, then every time somebody got bit by a shark, we wouldn't be able to go tell people, hey, there's a shark bite that just happened at Lumahai or at Anini or wherever it may be, right? If their rationale was true, then you couldn't tell the public that somebody got bit by a shark at a beach. So I knew it was BS. And 2 or 3 days later, the truth came out. They didn't want COVID-19 patients to be ostracized by the community that they lived in. In other words, like some dreaded disease that, like leprosy. Maybe they think we're back in those days where, if you had leprosy, you were ostracized, actually taken to another place. But that was what they said. It was they didn't want these patients to be ostracized. And I told Charlie, you're only going to be ostracized if you didn't quarantine yourself.
Yep.
If you went out like a fool and a selfish punk and went out and knowing you had the disease and went out and spread the aloha, then of course you can be ostracized. But if you came back from the mainland, if you had symptoms and you stayed your butt home, you're not going to be. In fact, people are going to be caring for you. They're going to be praying for you. So I didn't buy that at all. I don't buy that, but that's the way it is. So we don't get to nowhere. They do a colorful map. They put colors on a map and said, this is where it is. But I shared it on Facebook yesterday, my friend in Korea. Every time there's an outbreak, they get alerted on their phone. They get alerted on their phone that, hey, someone just tested positive in this province or in this city or in this county. What's the secret? You're not giving the name. But I know that if I find out that in the Wailo House Lost there's 3 cases, I think we have a right to know. I think we have a right to know. Charlie,
well,
I know you're very upset about this one.
Well, I looked at that map. Okay, they showed the different counties, right? And I still got to learn how to read that map because I look at Honolulu, gone bright red, going right across from downtown Honolulu all the way to Kailua. But it goes through a lot of forest land. So I'm telling myself, okay, it's an infection in the forest. So then I start to wonder, hey, am I reading this damn thing right or what? Because I know there's places in the rest of the US that when they have an infection or a spread, they actually place a pin and they show them by dots the area. I mean, giving me one color code that just, if at the rate they're going, pretty soon, 1/2 of Oahu will be all red. I hope that doesn't happen, but if it does, it's telling us, okay, this half is infected, the other half is not. But that's all it's telling you. And heaven forbid if you live in this red section, because it could be it doesn't pertain to your neighborhood, but it pertains to the next neighborhood over or something of that nature. So I don't know. I wish this wasn't funny. I wish, but when you come across something like this that is so serious, gang, I mean, both Mel and I had been cops before. I furthered my career at the Honolulu Medical Examiner's Office, and you see death in, day out, day in and day out. At the time I was working there, 300 plus deaths a year, just me alone. You kind of go stir crazy a little, and you gotta find something to take your mind off of it. And for me, humor was it. So I'm just hoping that we can get over this hurdle. And I'm hoping to see, today Governor Cuomo said that, are they on a down slope now, or are they at their plateau? He said that today. And to me, that was very promising. The only thing that I see, Mel, that I'm a little afraid of is once this is all said and done, how do we know if it doesn't reactivate again? That's my question. And
It will.
yeah,
I mean, this.
but hopefully by then we build up an immunity to this thing, right? I mean, that's what we're gunning for, right?
Well, those that survived and
Yeah.
those that got the virus and survived will build up some immunity. Those of us that, God willing, we don't get it, we won't have an opportunity. Not that I want that opportunity, but the reality is that it'll be like any other virus that pops up that has an opportunity to come back to the islands. And we can only hope that we have a vaccine, we have an antidote. I mean, they're doing a lot of people getting tested right now, all kinds of tests and experiments, and we're hoping that we can figure out a way to beat this thing. I did want to. I know somebody just posted that most of the infected are visitors, but it's not. It's on Kauai. It's 11 residents and 5 visitors. So we are now more than double the number of visitors that are infected. And while they're supposedly or allegedly all travel related, that's 11 people on our island that has the virus. And how many people did they come in contact with? And they did. And you see what I'm saying? It's
yes.
So it's not something to take lightly. And excuse me again, because I want to try to get as many questions as I can. There was a question about green waste. I believe it's closed. I'll pose that question and post it on my wall tomorrow. I'll get the right answer. I don't know. Things change. This administration on Kauai, I'm very happy with the way they've handled it, and they've amended rules to adjust to the changes. And I will definitely follow up on that tomorrow and post that on my wall. Let's see, if the state lets the people know what places were exposed, it would stop a lot of gossip. That is for sure. Let's see, our kids, okay. Anyway, Charlie, anything real quick while I going through this stuff?
No, it's just reminding everyone, there's been a lot of talk about our kupunas. And, I know now there's a lot of organizations out there that we want to make sure our kupunas are fed properly. But at the same token, we don't want them to be infected as well. So we have to use due care. So I applaud all those, the fishermen that's been going out constantly getting as much fish as they can to feed our communities. Because in the end, it's going to boil down to the community helping the community. I mean, right now we can see the government getting overtaxed. I mean, it's happening right now. So we have to rely a lot on what we can do. And, remember back in the old days as police work, the police can't do everything, but yet you can be the eyes and the ears, right? Well, I think in this case, the government can't do everything, but we can start policing. And, for those people who has lost faith in somewhat about how the system runs regarding the quarantine and all that, I urge you, please do not throw in the towel. You bring so much information to our law enforcement. If you see something occurring out there and you see people violating, of visitors that are here that's violating the quarantine rule, please call it in. Give your local law enforcement agency as much information as you can. It's vital. It's very important, because the bottom line is we're trying to stop the spread. And by actions people take, they may not feel it, but they could be a carrier, and it's very easy for them to pass it on. Very easy for them to pass it on.
For weeks, I've been saying, assume that everybody has the virus. assume that every single person has the virus. You have to. So if you see a bunch of people on Kekaha Beach, if you see, and I see Kalani Vera on there, he just made the best comment of the night. The vaccine is isolation. Isolate yourself from any possibility of catching this virus and you will not get it. I love it. Thanks. Actually, he's on the list. I got to get in touch with him to be on one of our shows. Want him to talk about a lifeguard. I mean, they're out there putting their lives on the line. If somebody's drowning or somebody needs help, they got to go help them. And whether the guy has a virus or not, they got to help them. But they're coming across a lot of people hanging out on the beach, sunbathing and relaxing, enjoying the sun. But we assume that everybody has this virus. So whether you're in Kekaha, Lumahai, and Kalihiwai, that's the 3 calls I got today with pictures. And obviously we, forwarded it to law enforcement. But it's important that at the time you witness that, you witness it. You call 241-1711. You
Yes.
make the call. Don't have to give your name. When they ask you what's your name, you say, I'd rather be anonymous, and just let them know that there's 6, 7, 8, there's a bunch of people hanging out, sunbathing on the beach. Let the officers go take care of them. They're going to give them a warning and they're going to kick them off the beach. But it does nobody any good if you come on Facebook and you post about it and get angry about it. You got to call the cops. You have to. And again, I don't want to get the locals in trouble. Imagine if they all got the virus. Or imagine if one of them get the virus. And that is the day at that beach that they were going to transmit that virus to the 4 others or the 5 others. Think of it that way. And then think about that guy going to Walmart and dropping it there with the store clerk or with a stock clerk. And that person going home and infecting. And you might think I'm going nuts. You know what? Even if I'm going nuts, it's better than not being real and letting this thing take over the island. There's no such thing as overreacting with this thing. And if you don't believe me, ask Charlie's brother's soulmate. Ask those people in New York. They're losing hundreds and hundreds and hundreds of people a day. Ask them if you think this is not real. So yeah, our police are amazing. Give all the lifeguards paintball guns. I love to see it. Sad to see KPD having to clear Baby Beach today, placing themselves in harm's way when it's necessary. That's exactly what I'm talking about. That's exactly what I'm talking about. It's people are by nature think about themselves, right? Selfish people, and we got to be more cognizant of the danger of this virus. So anyway, any more questions? Let's see. We got a bunch of people on here tonight.
Yes, thank you, everybody. Because without you getting the word out, everything that we try to do, this is not about Mel and Charlie. This is not about us. This is about us wanting to help the community. And it doesn't only have to be Kauai. Yes, we are located on Kauai. It doesn't only have to be about Kauai, because we know we have many others that are viewing from other areas of the state and in the US, because we see the questions and we see the comments coming over. So it's about us getting the word out, because it may affect a smaller community that might be located in, say, Idaho, and they're viewing this right now. It's going to help them, I believe, because getting information out is the best thing anybody can do. And we try to get the right information to you. And Mel, you talked about going into a Walmart or a Costco, one person infecting, right? Well, last night we had Lindy Coit, State Representative Lindy Coit from Molokai. That's what happened. That's what she said. One person, not under quarantine, but I guess one person went in, or was later discovered, went into the store, and bingo, the store gets shut down. Now they got their second case. So now they have to disinfect those stores. How much of an inconvenience now, but it's for safety reasons, right? But just imagine and I say this, I don't mean to pick on the individuals, but if I went to Vegas, and I know there's a lot of cases reported from Vegas, and I don't feel the symptoms, I would isolate myself just to be cautious and be precautionary. I believe you talked about a friend that was supposed to come home but went to another island to quarantine, right? Because that's where his plane stopped off. So he didn't want to take a chance. He's being responsible. He doesn't want to take a chance on infecting anybody else if he should have the virus. He hunkered down on the first island that he landed, and he says, "Yeah, I'm going to wait this thing out until I'm cleared." I mean, that's being real. That's being real with himself as well as his community that he loves.
Just being responsible, man. He didn't want to, possibly came back from Canada. He didn't want to potentially be the one to take it to Molokai. He was with his daughter, and he did the right thing. And that's what I mean. If he sacrificed, keep his butt in a hotel room for 14 days, actually it was going to be 15 days, and then get on a plane to go home to Molokai and have to quarantine another 15 days because the inter-island quarantine was in place. But he did it because he felt he was responsible. And I think, more people has to be that way. I did want to do a shout out to all of our utility workers as well. All of the essential workers out there that's got to deal with the public. Our UPS drivers. Online ordering has blown up because everybody's ordering online. And I just ordered seeds for my garden online because I feel so guilty to go drive around for go buy non-essential seeds for my garden. So yeah, I paid a little more than I would have, but I don't dare see one of you guys out in Walmart buying seeds for my garden after I tell everybody to stay home. But so these UPS guys now got to take care. And remember all the hands that touch that box before our UPS guy get them. So stay safe, UPS. Thank you guys so much for what you guys do, because I know a lot of people are using you guys now, and we just got to really be careful and protect yourselves. Let's see here. Hold on.
Yeah, we got one individual just wrote, and yet you're absolutely right. It's up to 1,400 officers NYPD affected. 1,400. Now, just imagine if Kauai, its police department, half the force get taken out. Then what do we do? The reality is there. Think about it.
The chief talked about it. He was on our show a couple of nights ago, 3 nights ago, whatever it was, and he said that's his biggest fear, coming to work and find out he lost 30% of his force because they're all at quarantine. Those guys can't go to work. Once you quarantine, you can't go to work. So I tell you, the ripple effect is incredible. Can you guys find out why it's taking 4 to 5 days for results? The 4 to 5 days is the confirmed reports. The tests that they're giving today, the presumptives can be relatively quick, within a day. But now Hawaii has the labs on Oahu are actually certified by the CDC, so they can do the confirmation. So from 7 to 10 days, and in Senator Kahele's instance was 16 days, but what was used to be 7 to 10 is now 2 to 4 to get the confirmed, certified positive. We get the presumptive a lot sooner, and that's why when you see on the daily reports, there's a number under the pending. Those are the tests that are pending a report back from certification. So yeah, it's I wish we'd get it quicker, but I can tell you what, 2 to 4 days is a hell of a lot better than 7 to 10 days. And it's gonna improve, and hopefully.
But can you just imagine the anxiety, you waiting for a result that many days? I mean, it's like you start conjuring up things in your mind like, hey, is it possible I am positive? You go back and forth. Next thing you know, you're actually talking to yourself in a bathroom and holding one conversation. You're going Lulu. I think it's bad enough this pandemic has hit us, but I think also they need to get results out quicker, because the anxiety can actually kill a person. If you're one of those that just have a hard time handling the news, whatever way it comes. I think they got to get the answers out quicker, sooner.
Yeah, and I mean, some places you can get in some tests. I know
15 minutes, huh?
the blood test, you can get a result in 15 minutes. It basically checks to see if you have the actual virus in your blood. If it's positive, then they do the swab. But I think as time goes on, we'll better improve the system. But every day we wait, every day goes by, we lose a lot of people. Look at how many people, like Troy says, over 1,000 dead overnight. Go to Facebook, pull up all your friends, minus 1,000. You don't get to pick who. Just take the first 1,000 off and see what you have left. That's the numbers, people. That's exactly what this is. We don't get to choose who lives and who dies. That's the problem. This virus it doesn't discriminate. Let's not forget FedEx. Absolutely. I'm sorry. I should have said FedEx, UPS, Postal Service, all of you guys that are out there doing the community a service. I'm in Wilcox, been here 5 days, no visitors. The halls are empty, no flowers, no nothing. People are having to endure alone. It's heavy. Sorry to hear that, Carol. I mean, again, we think about ourselves, but tomorrow night, we're going to hear it straight from the soulmate of Brother Charlie's brother, Eddie. We're going to hear it. And I bring you a tissue because I don't think it's going to be an easy one. But I thank you, Charlie, for making her available. Thank you for allowing us to share, or allowing her to share with us. I think that's going to really open some people's minds up. We're going to hear it straight from a woman 48 hours after she lost her soulmate. And we're going to have her on tomorrow night at 7 o'clock. Thank you, Charlie, for that.
No, I feel, and she felt the same way too. She couldn't do it tonight because it's still rough. But she did talk to my wife and explain to her what we're attempting to do, and that is to let you feel, let you experience that if you don't heed the warning about staying home, if you contract this deadly virus, you can read about it in the news, but you're going to actually feel it firsthand. And that's what we want to do, is get you to feel it, so you know that, especially for you parents that have teenagers that are still bucking the system, they don't want to listen to you, or you have young adults, young 20-year-olds that live home with you and they think that they're immune to this. Well, ask them to stand by, sit down and listen to her tomorrow. And then you make a decision whether it was meant for you or it wasn't meant for you. Because should something happen to you from tomorrow on, please, I don't want to hear down the road, hey, uncle, you was right, but I never listen. It's too late already. Just like when I use, every once in a while I use humor when my wife gets upset when I use humor, but I use humor. I said, by the time you smell a fart, you've already been infected. Okay, you don't have chance to duck it. Okay, it comes up, boom, you nailed, right? So this is going to be some serious stuff we're going to talk about tomorrow.
Well, it's scary, but it's real. It's real,
Yes.
And I think that when you put that human element, that human emotion, reality, maybe we can get. Yeah, we told you guys. Well, I don't know how long we've been doing this now, but we told you guys we're gonna pound this every single night. You guys don't listen, you don't have to watch, but I think it's important not just for you folks to listen. Share this. Share this video. You can hit the share button. You can, after we're done, you go back to the post. You can hit the share button and get it out there. We don't get paid per click. We don't get paid per view. We're not telling you guys to do this because we're getting paid every time somebody watches this. We're doing this because we want the word to get out. And we try to find interesting people. Tomorrow we got, what is her name, Charlie?
Her name is Mary Frida.
Tomorrow we got Mary Frida. Tuesday night we got Lieutenant Governor Josh Green. Lieutenant Governor Josh Green. That one's going to be interesting. We'll be able to ask him questions and get it straight from the horse's mouth. I know Josh Green well. and I know that he ain't gonna hold back. So tomorrow night, Tuesday
Yep.
night, Wednesday, Thursday, Friday. We appreciate you guys joining us. I think we're about at the 1 hour mark.
Yep.
We don't want to go beyond the hour, so we're just gonna say thank you very much. Charlie, any closing comments, buddy?
I just like to say, Kauai, I love you. We are community standing strong. We'll get through this. We'll do it together. Mahalo. Thank you.
Charlie, we love you very much. Again, our prayers, I know I speak for everybody on this call. Prayers go out to you and Steph, your
Thank
entire
you.
Ohana. To all of you that took the time to watch us tonight, thank you again. We'll see you guys tomorrow night. Love you guys. Bless you. And most importantly, stay safe. God bless.
Yeah. Aloha.
Aloha.